Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Before we start, let me ask you a question. Have you ever felt burning when you pee, kept running to the toilet again and again, but felt too shy to tell anyone? Burning when you pee is not just a small problem. In this video, you'll learn when it's simple and when it's a warning sign for your kidneys. Today, we are talking about urinary tract infection, or UTI, when you can relax, when you must worry, and what you can do to protect your kidneys. Doctor, let's start very simply. What exactly is a UTI?
A UTI is an infection in the system that makes and carries your urine. That includes the kidneys, the tubes from the kidneys, the bladder, and the urethra, the small tube where urine comes out. Most people, when they say UTI, are talking about an infection in the bladder, a bladder infection. If the infection reaches the kidneys, that is a kidney infection, and that is more serious.
So it is not just dirty urine. It is a real infection in the system. People often tell me, but I keep myself clean. Why did I get this? What usually causes a UTI, and which germs are involved?
That is a very common question. Most UTIs are caused by bacteria, and the number one germ is called E. coli. These bacteria normally live in the gut. It is not always from bad hygiene. Sometimes the bacteria move from the back passage area to the front, then into the urethra and up into the bladder. Your risk is higher if, for example, you do not drink much water, you hold your urine for a long time, you are sexually active, you use some types of contraception like spermicides, you have diabetes or weak immunity, you take some medicines that make it harder for your bladder to empty, or that weaken your immune system. Or you have problems with urine flow, such as stones or an enlarged prostate. It is usually a mix of bacteria plus an easier way for the bacteria to enter the urinary system.
That makes sense. Now, if someone who's watching us is wondering, do I have a UTI? What are the usual signs and symptoms they should look for?
For a simple bladder infection, people often notice things like burning or pain when they pee, feeling like they need to pee all the time, needing to go to the toilet more often than usual, pressure or mild pain in the lower tummy, urine that looks cloudy, has a strong smell, or sometimes has a little blood. If the infection climbs up to the kidneys, the symptoms are stronger. You may have fever and chills, pain in your back or side under the ribs, nausea or vomiting, and you feel generally very unwell and weak. Those are warning signs. Kidney infection needs urgent medical care.
So, burning urine and going to the toilet many times might be a UTI, but fever and back pain are more serious and may mean a kidney infection. If a patient comes to your clinic with these symptoms, how do you confirm that it is really a UTI?
First, we talk and listen. I ask about the symptoms, when they started, any past infections, and other health conditions. Then I examine the patient and check for tenderness over the bladder and the kidney areas. Next, we do a urine test. The patient passes urine into a clean cup, and the lab checks for signs of infection like white blood cells, blood, and bacteria. Sometimes we send the urine for a culture. That test grows the bacteria and helps us see which antibiotic will work best. If infections keep coming back, or if the person is very unwell, we may arrange an ultrasound or other imaging to look for stones, blockage, or other problems in the urinary system.
Once you are sure it is a UTI, the big question is, how do we treat it? People often want fast relief, so what does treatment usually look like?
Treatment depends on how severe the infection is and on the person's overall health. For a simple bladder infection in an otherwise healthy adult, we usually give a short course of antibiotics by mouth and advise the person to drink enough fluids. We may also suggest safe pain relief if needed. If there is a kidney infection or if the patient looks very sick, we might need stronger antibiotics, sometimes given through a vein in the hospital. We also treat dehydration, pain, and any other medical issues. One very important point: you must finish the full course of antibiotics even if you feel better after 2 or 3 days. Stopping early can let the infection come back and can make the bacteria harder to treat next time. The exact antibiotic and dose depend on local resistance patterns and on your personal health, so your doctor will choose the best medicine for you in your country and in your situation.
That is a very important reminder. Do not stop the medicine too early. Now, some people watching us may say, "Doctor, I get UTIs again and again. I'm tired of this." What does it mean when UTIs keep coming back, and how do you deal with that?
When UTIs come back many times, we call this recurrent UTI. For example, if someone has 3 or more infections in 1 year, or 2 or more infections in 6 months, we say they have recurrent UTIs. In that situation, we don't just give antibiotics and move on. We try to find out why. We look for patterns. Do the infections happen after sexual activity? Is there a problem with bladder emptying? Are there stones, an enlarged prostate, or nerve problems? Does the person have diabetes or very high blood sugar? We often send urine for culture each time to see if it's the same bacteria or a new one. We may arrange imaging, like ultrasound, to check the kidneys and bladder. For treatment and prevention in recurrent cases, we try to correct any underlying problem. We teach careful habits like not holding urine and drinking enough water. And in some selected people, we may use longer or low-dose preventative antibiotics. For some women after menopause, vaginal estrogen may be considered, but only under medical supervision. The key message for recurrent UTI is do not keep taking random antibiotics without a plan. Work with your doctor to understand the cause and build a long-term strategy.
That is very helpful. If someone ignores their symptoms or keeps delaying treatment, what serious problems can happen from a UTI?
The main serious problems are kidney infection, which can be very painful and dangerous, possible kidney damage if infections are severe and repeated, and in some cases, infections spreading into the bloodstream, which we call sepsis. That is an emergency and can be life-threatening. In pregnant women, untreated UTIs can increase the risk of problems for both mother and baby. So we never want to ignore strong symptoms, especially if there is fever, vomiting, or feeling very unwell.
So, early treatment really protects the kidneys and can prevent serious trouble. Before we close, let's talk about something positive: prevention. What are some simple daily habits that can lower the risk of getting a UTI?
The good news is there are many practical steps. Drink enough water during the day, unless your doctor has told you to limit fluids. Don't hold your urine for long periods. Go to the toilet when you feel the need. After using the toilet, wipe from front to back, especially for women, to reduce the chance of bacteria moving from the back passage to the front. Urinate after sexual activity to help flush out bacteria. Avoid strong soaps, sprays, or douches in the genital area because they can irritate the skin and disturb the natural balance. Wear light, breathable underwear, like cotton, and avoid staying long in wet clothes. If you have diabetes, keep your blood sugar under good control. For people with recurrent infections, your doctor may give more personalized advice based on your situation.
Those are very clear. To make it easy for our viewers, could you share some simple do and don't points for anyone who is worried about a UTI?
Of course. Do see a doctor if you have burning urine, if you need to pee very often, or if you see blood in your urine. Do seek urgent care if you have those symptoms plus fever, flank or back pain, vomiting, or feel very unwell. Do drink enough water within the limits your doctor gives you. Do take your antibiotics exactly as prescribed and finish the full course. Do contact your doctor again if your symptoms are not improving after 2 to 3 days of treatment. Now the don'ts. Don't use leftover antibiotics from old prescriptions or from family and friends. Don't stop treatment early just because you feel a little better. Don't ignore new, very strong or very different pain in your back with fever and urinary symptoms. Don't try to treat strong UTI symptoms only with home remedies or herbal pills instead of seeing a doctor. And don't feel shy about talking about urine or urinary symptoms. Doctors hear this every day. It is normal to talk about your health.
That was very clear. Before we finish, could you share one final doctor tip you can trust about UTIs?
My final tip is this. A UTI is common, but it is not nothing. Listen to your body. If your urine burns, if you go to the toilet many times with discomfort, or if you feel feverish and have back pain, do not wait and hope it will just disappear. Get checked early. Early treatment is simple and can protect your kidneys and your life.
Thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Don't forget to like, share, and subscribe for more trusted health tips. And remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.